And we will go live on YouTube. I think we are already live. It's always hard to tell. Anyway, super happy to be here for another episode of Clear Vision Wednesday. I am Claudia Mühlenweg, the founder of the Natural Clear Vision Institute and the creator of the Natural Clear Vision Method. And today we have a really important topic. This is mostly for women, I would say, but even if you're a man, it's a good topic to listen to and educate yourself about. So we will talk about how hormones can really mess with our vision and what to do about it. And I have a friend and special guest here today. Let me bring her on, Dr. Tabatha Barber. Hi, Dr. Tabatha.
Hi, Claudia. Thank you so much for having me. This is such an important conversation.
Absolutely. And you're the expert on hormones. I'm definitely not. So you overcame, I mean, we've been friends for like a little bit over 3 years, and I know that you overcame a lot of, you were a high school dropout, you were a single teenage mom, you had like all the things. And now you're one of the leading gynecologists educating people with a functional medicine background on hormones and how to have optimal health as a woman. So how did you get into that? Tell us just a little bit about that, and also maybe how your own vision fluctuated or how your hormones impacted your own vision.
Absolutely. So it's really interesting looking back. You always have 2020 vision looking back, right? It's
Right.
like Monday morning quarterback. It, but at the time, I didn't see how all the puzzle pieces fit together. So essentially, I was very stressed out being a teen mom, a high school dropout, trying to, you know, physically overcome a traumatic delivery and all of these things. And I went on to develop Hashimoto's thyroiditis, which is an autoimmune attack on my thyroid. And my thyroid was very overactive. I started losing weight drastically, which, doesn't happen very often after delivery. And I was sweating and shaky and anxious, and I would have blurry vision, trouble like focusing on things, not being able to see. And I didn't really understand how all that, went together until later on in life. But essentially, a lot of things were done to me. Nothing was really explained. And, there was no informed consent. So I came out of that experience really determined to help women have a voice and a choice when it came to their bodies and their health, because I didn't have that. And what they ended up doing was giving me radioactive iodine and burning my thyroid out. And I didn't understand that that was a lifelong consequence that I was going to have to live with it, but that conversation never happened. So those things kind of propelled me to get my life together, go back to school, get my GED, become a doctor, all of the things. And I remember I went through undergrad, which was very grueling, ended up having to do 6 years instead of four because there was a lot of gaps in my education. I really didn't care about school when I was younger, and so I had to do a lot more extra schooling. But by the time I got into medical school, I couldn't read the chalkboard and the big lecture halls and those types of things. And the only thing I thought was, okay, I need glasses, right? That's immediately what you think. And I did glasses all through medical school. And then when I got into residency, um, women might be surprised to hear this, but OBGYNs are surgeons. So I spent 4 years in a surgical residency. I was constantly in the OR wearing a mask and, um, protective gear over my face, and my glasses would fog up. So I got contacts. And after that, I was finally, I finished residency, I graduated, and I'm now an attending physician, and I could afford LASIK. So I went and got LASIK, and I was really excited about that because the glasses were driving me crazy. And so I thought, that's it. I'm all better, right? I fixed the eye issue and I'm good. And lo and behold, I hit my 40s, and one day I couldn't read my phone. I just remember like pulling it away from me and going, huh, that's weird. And it kept happening every morning, and it would happen for a few hours at a time. And the crazy thing was, when this was going on, I was also suffering with some really severe depressive symptoms. I was feeling like weepy for no reason, disconnected from my husband, not wanting to participate in my life. And what was happening was my estrogen was dropping. My hormones were rapidly declining. And we can talk about why all of that is. But it was at that point that I started to realize, I think your eyesight is affected by your hormones. And so I
Okay.
went back and I started studying and investigating. And lo and behold, everything I had gone through, over the past 30 years, it was all because I was having hormonal shifts and an autoimmune response in my body. And so I think those things are really important for us to unpack and talk about today, because women aren't being told this, honestly. They're told it's just like a physical external problem with your vision, and that's not necessarily what's happening.
Thank you so much for sharing that. And you definitely went through a lot of different things. And yes, and LASIK is really like the same thing, like it's kind of a surgery, right? It's like you fix the problem, but it doesn't, last. And that's another thing about LASIK. And there's many reasons why I don't recommend it. And it worked for you for a while, right? But what we want to really talk about is how understanding that maybe your hormones could be the reason that your vision became blurry, like just like you even had as a really young woman, so that you don't just get the glasses. You probably could have easily prevented them in college, right? But back then you didn't know. And once you have the glasses, it usually leads down like a slippery slope and it gets worse and worse. So what would you say is like the biggest, like, depending on what age you are, right? But what do you think are the biggest things that women need to know? Let's say before menopause, and then we can get into perimenopause and menopause. But what are the biggest things that we need to be aware of when it comes to vision and hormones? Like, what are like warning signs? Blurry vision, obviously, on the vision part, but what could be the underlying reason?
Yeah, so if we go back to the beginning of my story, when I was pregnant, your estrogen and progesterone levels are really high during pregnancy. Those are growth hormones. They're, creating new life, they're sustaining new life. And it turns out we have estrogen and progesterone receptors all throughout our body, not just in our uterus and in our breasts. We have them in our eyes, in our cardiovascular system, in our skin, in our bones, all over the place. And so our eyes are affected when our levels go up. And we see this with puberty when women or girls have this surge of hormones that they didn't have before. These levels get really high. It's common for girls to start to have some nearsightedness and not to be able to see far. And then things balance out, and hopefully their body adjusts to these hormone levels, and it's not usually an issue. But what we also came to understand is that a lot of girls and women go on birth control pills, which are synthetic forms of estrogen and progesterone. They're not the same chemical in our body. So our body responds a little bit differently. And the eyes can be one of those reasons. So it's common for women to go on birth control pills and have a change in their vision. And nobody's putting two and two together. They're just going and they're getting their glasses or whatever. So that's just something to be aware of. And, birth control pills unfortunately have a lot of detrimental effects to our health, which I unpack a lot in, my podcast, The Gutsy Gynecologist Show, where I talk about how those synthetic hormones cause gut dysbiosis and leaky gut and vitamin and mineral deficiencies. And they really do shut down our own hormone production. And for a lot of women, when they try to get off of the birth control pill, their period doesn't come back regular because their hormones are no longer balanced. And so this can manifest as fertility problems, weight issues, moodiness, anxiety, depression, but also, again, changes in the vision. So just something to be aware of. And then the pregnancy, right? I was saying your hormone levels are really high. And what also happens in pregnancy is our immune system really has to get turned down in the way that it responds. Because if you think about it, half of the baby that you're carrying and growing is foreign DNA. It's from another person. You know, your partner's DNA is in your body, and normally your immune system would attack that, but your body doesn't want to abort the fetus, so your immune system gets downregulated. And that downregulation is a protective mechanism. It results from the high estrogen, but when you deliver the baby, everything shifts. The estrogen drops, the progesterone drops, and the immune system comes back online, and sometimes with a vengeance. So we see this surge of autoimmune conditions erupt after pregnancy. It's very common to get a thyroid disease after pregnancy, or a lupus flare, or MS, or something like that. And when that shift occurs, sometimes vision changes are like the number one signs. Another autoimmune condition I see a lot is called Sjogren's. It's spelled kind of funny. It's Sjogren's, but the main symptom is dry eye. And so you have this autoimmune attack happening, and it's destroying your eye's ability to create moisture and to accommodate. And then you have this low estrogen, so your cornea becomes stiff because estrogen gives it that elasticity and that movement and that mobility. Estrogen does the same thing in our cardiovascular system. So our tiny little arteries that pump our blood throughout our body, they're nice and elastic and mobile, and they move and they squeeze and they pump the blood. But when our estrogen drops, like with menopause or postpartum, those arteries get stiffer. And so we have to pump the blood harder from the heart to get to our body through those arteries. So our blood pressure often goes up. And that's just a response of that low estrogen, that stiffened artery. And the same thing's happening with the cornea and the other muscles and organs in the body that are dependent on that estrogen for their fluidity. So you can see tons of shifts during these hormonal changes of postpartum, menopause especially. So that's really important for women to understand, because maybe you don't want to jump to glasses or LASIK. Maybe you want to ride out this hormonal shift because it's going to change, like postpartum, or you want to consider hormone replacement therapy because that is going to prevent long-term changes and worsening progression of disease in the long run, right? So I think it's really important to kind of know all of that.
Wow, that was so much. I mean, I never thought about it being a foreign body, when I was pregnant with my daughter. But oh my God, it's like the light bulbs went on and all makes total sense. I actually have a family member who was not pregnant and who had ended up having a hysterectomy for I can't even remember why, but I know that she ended up getting thyroid hypothyroidism, right? The low function. And I think that was even before the hysterectomy. Yeah, it was before, so pretty early on. So that's so interesting. I mean, it's like, yeah, the regular gynecologist doesn't tell you any of those things. They tell you in menopause, take some estradiol or something, like some kind of tablets or something, but they don't actually talk about how this how all this works together, right? It's like you said, it's like a sex organ problem, right? It's like super. I'm learning so much from you. This is very fascinating, and how I didn't even know we had receptors in the eyes, for instance. This is very powerful. Thank you so much for sharing that. So I'm trying to formulate a good next question about this, because so basically, I think what you just said about writing out the hormones, or connecting the dots, is it really my vision all of a sudden failing me, or is it the hormones? And then working with somebody like you, functional medicine gynecologist, who understands all the connections, right? And doesn't just tell you, oh, you're at that age. And I'm just thinking out loud. You talked about teenagers often getting glasses. And I connected that to the stress, right, of being a teenager, being like that awkward period. But I never thought about the hormones. So the hormones can also play a role in actually exacerbating that problem. And, it's like that cocktail that makes your vision get blurry and create the higher risk of nearsightedness, plus the
Mhm.
studying in high school and in college, right? So,
Yeah,
and you
I
talk,
would
go
I
ahead,
would love
sorry.
to talk about that. I think that's
Yes,
really
go
important
ahead.
because there is this connection of stress with our sex hormones that a lot of people just they downplay it like, oh, I know I'm stressed, but I can handle it. So you might be able to handle it mentally, but your physiology is responding in a certain way. It doesn't matter if you can handle stress mentally, your physiology is responding. And so what happens is, we have these endocrine organs. Endocrine organs are the ones that make hormones. And we don't have just sex hormones like estrogen, progesterone, testosterone, but we have other hormones. We have adrenal hormones like cortisol is our stress hormone. DHEA is our reparative, regenerative hormone that keeps cortisol in check. And that's like progesterone keeps estrogen in check. Estrogen grows things and progesterone prevents overgrowth of things. And we have our pituitary gland and our hypothalamus in our brain. And these guys are talking to our endocrine organs. So they're talking to our thyroid, who makes thyroid hormone. They're talking to our adrenals. They're talking to our ovaries. And in response, those organs are making hormones and those talk back to the brain. So it's a two-way communication and there's cross communication. So if you are chronically stressed, meaning even if you're handling it just fine, you are going from dusk until dawn, you are busy, 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 you're not really processing anything that's happening, you're just like, doing all the things, even good stress, like planning a wedding or going on a vacation or training for a triathlon. If you're producing excess cortisol, you have to use your progesterone to do so because progesterone is a precursor to cortisol. So you steal your nice calming anti-anxiety progesterone hormone to make your stress hormone cortisol. And then you get out of balance and you have this excess estrogen, even though estrogen itself isn't too high because progesterone isn't high enough to keep it in check. You turn into an estrogen dominant picture, and that can start to cause heavy periods, painful periods, PMS, fibroids, endometriosis, biting your partner's heads off before your period. We all know these symptoms, right? And they get exacerbated the more cortisol we produce. And so then you get stuck in this vicious cycle because now you're cranky and irritable and you're having heavy periods, and that makes you even more stressed out, right? And then you get stuck in this cycle. And a lot of things are happening during this time. Unfortunately, excess cortisol kills off the good microbiome in your gut, the good bacteria, and causes temporary leaky gut. So then you can get set up for food sensitivities and not digesting your food properly and bacterial overgrowth and all the other things that go with that. And that can affect your mood even more. And so the vicious cycle just keeps pulling in other systems, like one after the other after the other. And after a while, your ovaries and your body say she's in survival mode. Like she can barely keep herself going. We can't reproduce right now. It's not safe to create another human. Let's shut down our ovary production, divert resources, and help her over here with these adrenal hormones and all of this stress. So then your periods start to go away or come every 2 weeks, and you stop ovulating and you really are losing your fertility because your body's not failing you or mad at you. It's trying to protect you and prevent a pregnancy that it isn't safe to have right now. And so all of these symptoms are warning signs from our body. Our body is screaming at us to say, hey, do something different. Listen to me. I'm begging you to stop living this way. And a lot of times we don't listen to these messages. We cover them up and we say they're just a bother, And so we take birth control pills to get rid of all these symptoms. We put the IUDs in with the synthetic hormones, or we get an ablation or a hysterectomy, and we're covering up that symptom or getting rid of that problem, but we're not fixing the root cause of this hormone imbalance and this adrenal issue. And so it's going to continue on and it's going to spill over, and eventually you're going to go on to develop some other disease, an autoimmune condition or cancer. That's just how the body works. So I invite women to start like realizing their body has an incredible innate intelligence, and it's always trying to keep you balanced and work in your favor and for your good. And if you can say, what are you trying to say to me? You're going to make so much more progress, as opposed to being mad at your body and hating it for always having symptoms and problems because you're not listening to your body, right? Our body doesn't fail us. We fail it.
Wow, that is, I mean, so much speaks to my heart what you just shared. And all the things that you talked about, I know friends and family members that did exactly that. The birth control pills, the IUD, all the things that you just mentioned is I took birth controls back in the day, just like you. I didn't know any better.
Right.
And I had symptoms eventually, and I had weird swelling and all my and nobody could explain anything. The doctors are just like, we don't know what that is, wear compression socks or something. That was in my 20s. And then I immediately stopped them. But yeah, so there's a question on YouTube that I think we could ask right now. Are there any estrogenic foods that help? And I don't know if that's the right question to ask, but that's a question on YouTube right now.
Yes. So turns out that food is super important when it comes to hormones. And let's talk about this for a minute. I talk about this in my book, Fast to Faith, because we have gotten into this culture where we eat the standard American diet. Everything is super processed and convenient because we're so busy. We're falling
Mm.
into that busy trap, which is just literally a distraction from the life you should be leading. So I invite you to see, can I stop being so crazy busy and actually pay attention to my food? Because food is information for your body. Whatever you're putting in your body, it's going to send signals of either health and repair or disease and inflammation. And so every time you put something in your mouth, think, what is this going to tell my body to do? Like if you're eating Oreos, it's going to tell your body to be inflamed and angry, and that is going to spill over into stressing out your adrenals and affecting your sex hormones. So it's really important to understand that fat is good and necessary for life. I grew up in the 80s and 90s, and it was the low fat, no fat diet was the way to be healthy and skinny. And it turns out that was a complete lie. And it destroyed a lot of women and caused a ton of hormone imbalance. We've seen diabetes skyrocket, breast cancer skyrocket, heart disease skyrocket since then, because cholesterol is the main ingredient to make our sex hormones. Estrogen, progesterone, testosterone, DHEA, even our stress hormone cortisol and aldosterone, our blood pressure hormone, it's all made from cholesterol. So if you try to decrease your cholesterol levels really low, you're not going to be able to make your hormones properly. We see this time and time again when women are put on high dose statins, which are drugs to decrease your cholesterol. That I have a whole episode on how that's a lie.
Wow.
It's pretty wild, but you need certain vitamins and minerals to be able to make these hormones and for the hormones to bind to the receptor on the cells and send the signal that you want that hormone to do. And so it's really common for us to get B vitamin deficiencies and not be able to hear the signals from our cells. And I'm seeing this more commonly because vegan diets are really popular right now. And we get a lot of B vitamin deficiencies on a vegan diet. And so we're lacking our fatty acids. We're not getting enough. We stopped eating butter. We stopped eating olive oil and coconut oil and all the healthy oils that we need to make our hormones. So it really is important of what you eat. So I think her question was in relation to maybe phytoestrogens. Phytoestrogens are categories of foods that kind of bind into those estrogen receptors on the cells, and they send similar signals to estrogen. And those can be really helpful when you're going through the transition of menopause and you're having hot flashes, night sweats, mood swings. Phytoestrogens can make you feel better. But here's the deal. There's also estrogen mimicking chemicals in the environment now that didn't exist 50 to 70 years ago. There's over 10,000 new chemicals that we've created in the lab since the 50s that did not exist in all of our, centuries of living. And they're forever chemicals. They're here to stay, and they bind to our estrogen receptors, and they send warped signals. They send these growth signals. So now we are seeing girls hit puberty at a younger and younger age because of all this excess estrogen from these toxins. We're seeing men with man boobs. We're seeing more breast cancers, more uterine cancers, all of the things. And it's because of these chemicals in the environment. It's not from our hormones. Hormones don't cause cancer. Let's just be clear about that. So let me just take a drink real quick.
Yeah, I think that's a really important point, the hormones, because they had, after this one study, I don't know, in the 90s or something, everybody thought hormones are the dangerous thing. So yeah, let's
I
thank
mean,
you so much.
can we just say if elevated hormones caused cancer, the majority of breast cancer would be in younger women, women in their 20s and 30s. It wouldn't be in older women. But so hormones don't cause breast cancer. I can go on for days about that. That's like 3 episodes in and of itself. But these toxins, these chemicals we've made, they're in fragrances, like those plugins you put in the wall, you make the air smell good. Certain candles, all the sprays, the perfumes, some of them, those fragrances are endocrine disruptors. They mimic estrogen and they feed growth of bad cells. So if you want to really get your hormones into balance, you have to detoxify your personal care products, your environment, your cleaning products, all of that. And ewg.org is a really great resource for that. That can be super helpful. And you might be surprised that once you get your hormones in balance, your vision is going to shift. Every time I got my hormones back into balance, I didn't have such a problem. And I will say, like, this is a dynamic thing because your eye health is dynamic. All of the cells in our body, once they grow, they don't just hang around for the rest of your life. They have a certain lifespan and they die off and get replaced. Like our skin cells average 21 days. And so when you have eye cells grow, they have a certain lifespan and then they need to be replaced. So if you are having an inflammatory diet and lifestyle, out of balance hormones, chronically stressed, excess cortisol production, the new eye cells that you grow are going to be inflamed. If they're full of those chemicals, they're going to be inflamed. And so the cool thing is you can turn all that around. You can reverse disease. I know that conventional doctors have a hard time agreeing with that, but here's the deal. I said I did a 4-year surgical residency. Yes, I became an OBGYN. I could do C-sections, deliver babies, do hysterectomies. I had to go on and study for years learning functional medicine and anti-aging medicine and all these hormonal intricacies that I didn't learn as a gynecologist. And so you have to understand that sometimes the information that you're receiving is limited by what they know. As a gynecologist, I had two tools. I had a birth control pill and surgery. Those are my options to treat people. And since I've done all this other training and taken care of thousands of women using functional gynecology, I have so many more tools in my toolbox. And there really are so many ways that you can reverse disease. I mentioned I had Hashimoto's. My antibody levels were just over 900. They were so high they didn't give me a number. Today, my antibody levels are single digits. They're like 2 and 5 or something like that. I have reversed my autoimmune disease by healing my gut and balancing my life with my diet and managing my stress, all the things. And when I got on hormone replacement therapy for my menopausal transition, that balanced my eyes out. And so everything affects everything. So, you know, we like to think you have to go to the ophthalmologist for your eyes and the gynecologist for your period and the gastroenterologist for your constipation. But it turns out they're all connected. And if you can find a functional provider who understands that connection, you can make really big shifts in your health and in your eyes.
That was so powerful what you said, Tabatha. I absolutely love your messaging because it's absolutely true. I mean, sometimes we do need a specialist to find something specific, right? Like an ophthalmologist needs to check your eyes and you make sure that the lens is okay and the retina is healthy. But yes, they don't connect the dots. It's all these like little silos of information. So there's a question also Tina is asking on YouTube. Curious about suggestions for premature menopause. I'm also struggling with eye issues, especially red eyes and floaters. Any thoughts on the premature menopause?
Yes. So hopefully she was on when I was talking about excess stress and cortisol production, because that is probably the number one cause of premature menopause. Like I said, when your body feels like it's stuck in survival mode, it doesn't want to procreate and reproduce. And so it will stop ovulating, and the eggs that you have left in your ovaries will just kind of shut off and die off. And once you stop ovulating, your ovaries kind of shut down and you would do transition. Now, I've seen a lot of women who are kind of in this perimenopause for longer than they need to be. You know, when I went to medical school over 20 years ago, I was told it was like a 2-year transition. You have a few symptoms and then you stop having your periods and you're done. Now we're seeing it in women 40 years old. So that's a decade of perimenopause, or sometimes even 35. So what's really happening is it's not just perimenopause. It's just chronic hormone imbalances from stress, from adrenal dysfunction, from, gut issues happening. And I should also mention, when I say chronic stress, it might not be you hate your job or you have a struggling relationship or you're not processing your emotions. It could be an internal stress, chronic gut infections that you aren't aware of, or tooth infections, or an Epstein-Barr virus reactivation, long COVID, all of these different things. Those internal stressors tank the adrenals just as bad, and that can lead to premature menopause as well. And like I mentioned earlier, so can being on birth control pills for decades. So I would invite her to find a functional practitioner to unpack all of that and see, are you completely menopausal at this point? Do you just need hormone replacement therapy? Or are you still in perimenopause? Can we salvage those ovaries? Can we get them back online and get them working again with a lot of love and care and support? That's always the question I'm asking when I'm working with patients. And The cool thing is my team and I are licensed in over half the country, so we see patients all over, which is really cool. And surprisingly, the complaints are the same from New York to California. Like, we're all struggling with the same issues. And it's just because nobody's really explaining any of this to us. You know, we go to the gynecologist for our pap smear every year, and they do some basic blood work and tell us we're healthy and fine, and we'll see you in a year. And a lot of that's just not true. There's a lot of warning signs that you get ahead of time that things are changing, things are impending, and there's so much you can do if you knew that, but we're just not checking the right tests. We're not having the right conversations and all of that. So that's why I love my job so much. You know, our first appointment, we talked to the patient for an hour. Like, there's so much information in your history, in your life of what you've experienced. I can usually tell somebody without even doing their blood work what's going on. It's pretty obvious.
You know, I want to come back to what you said a while ago about how, you know, you talked about our skin renewing every 21 days and all the cells in our body. And I think that's always the message of hope, because we could, I mean, I used to smoke cigarettes, you know, I took birth control pills. I had a crazy stressful job in advertising. But I'm like, oh my God, I'm doomed. But, you know, yet I was able to get out of my glasses actually at the beginning of my 40s, you know, for good. So I think what you said is so powerful, that we always have the choice to make, even if we have all that history, right? We can't erase that, we can't change that, but we can make better choices moving forward. And so finding a functional medicine trained gynecologist, because I have one I see in Germany, and I do literally what you just said, the pap smear, whatever, but I work with a functional medicine doctor here in the US. So I just, you know, I do that because it's part of what the insurance pays for, you know, it's just the regular, just making sure that's all okay. So any other tips you could give us here today in terms of, like, what could we do? Now you did a great job educating us on how this all connects, how the different hormones, how the stress levels connect. But what is, like, what are some things that people could do other than contacting you? We put all your information in the show notes, but what can people do? And we also had a man saying, what about me? To really help to help them, you know, balance the hormones, because we now know how much effect that has, not on your just on your eyes, but literally on everything.
Yeah, so I'm glad there's a man watching because this does affect him as well. Men are having lower and lower testosterone levels every decade. And the biggest reason, like I mentioned, are those endocrine disrupting chemicals in our personal care products, in our cleaning products, in our water supply. I would say if you want to make the biggest impact on your hormones, you have to love your gut and love your liver. And the way to do that is to stop drinking alcohol. This is not a very popular
Uh-huh.
recommendation, but I promise you, if you make alcohol special again and you only have it once or twice a month, your liver is going to be able to metabolize or break down your hormones so much more effectively. Alcohol is actually the biggest modifiable risk factor for breast cancer. So the more alcohol you drink, the higher your risk of breast cancer goes, because you are metabolizing your estrogen down the wrong pathway when you drink too much. So if you change how much alcohol you're drinking and you get rid of your standard American diet, like, you start eating real whole clean foods, more healthy fats, more proteins, like, you don't have to be carnivore, but I really want you to, like, get a clean, healthy diet of protein, fats, and fiber. And that is going to shift your overall health immensely, and in turn, your hormones and your vision. Like, those two things, that's probably 80% of it. I'm serious. It really is. And I wrote this entire book on fasting because fasting is the quickest way to start healing your body and reversing disease. When we stop eating, especially the standard American diet, our body does this really incredible process called autophagy. It starts creating cells that go around and eat all the other bad cells and recycle them and get rid of them so that they can't go rogue and turn into cancer. So fasting is like, if you have an autoimmune disease, if you have uncontrolled diabetes, if you have cancer or precancer cells or tumors you keep growing, if you start incorporating a fasting lifestyle and you clean up your diet, like your health is going to do a 180. It's absolutely incredible. It's my number one go-to. The only people who shouldn't fast really are pregnant women and nursing women, and maybe frail elderly people. That is about it. Like everybody else, your body was created to fast. We were created to go time periods without food. We did not, come to this earth with grocery stores on every corner. This is a new thing for us. We've existed for centuries without it. And this is a major way to get your body into healing mode.
Awesome. And how long would you recommend to fast and how often? That would be my final question. And then wrapping it all up.
Yes. So I love this question. Here's the thing. I promote a progressive fast because so many of us are stuck in sugar burning mode. So many of us are eating a lot of carbohydrates from dusk until dawn that if we try to go without food for 16 hours, we get shaky and hangry and jittery and nobody wants to be around us because our body hasn't been in fat burning mode for so long. So we've lost some of our metabolic flexibility. So I teach a progressive fast where we start to eat more fats and protein. We start to cut the carbs out. We break up with sugar and get rid of the snacks. Then we shrink our eating window and get our 3 meals in a tighter window. And then we can eventually drop off breakfast and eventually go to a dinner to dinner fast. And then we can do a 3-day water fast for maximal healing. And I promise you, I've had uncontrolled diabetics. I had a woman in her 70s who reversed her uncontrolled diabetes just by doing this progressive fast. It was so exciting. But I see this all the time. Like if you do this stepwise approach, you're setting yourself up for success and it actually feels amazing. And women are like, oh my gosh, I have so much energy. My brain is clear again. I'm functioning, as opposed to just trying to do the fad diet where and everybody's miserable and like, oh, fasting's not for me. Fasting is for you. That's how your body was created. So try it again. Take another look at it. I promise you it's worth it.
And we have all the links. I absolutely love that idea of slowly. I actually did that a few years ago, and I haven't been eating breakfast actually since like 6 years. And I never liked it as a kid. I was like, yes, I have the permission to not eat breakfast, and I'm doing so much better on this kind of like restricted eating window of intermittent fasting model. And I have to do another, what you just said about the water fast. I'm ready for, but I haven't done that in probably 2 years. I'm like, I have to be in the right mood for that, for me to do it. But yeah, thank you so much. This was incredibly powerful. So to recap, it's about avoiding all the toxins. We have so many chemicals around us. My daughter used to work at what is it, Bath and Body Works, where you buy these wall
I
plug-ins.
can't even walk by that place.
I know, and now I get, when somebody, if I'm ever in the train or a contained space or somebody in the elevator has like strong perfume, I get really bad headaches, and if somebody uses strong laundry detergent, I'm like, my body reacts like in crazy, now that I've cleaned out my system, because before I didn't know, and now that I'm eating clean and I'm following a lot of the protocols that you shared, I'm so like, and my mom's like, why are you so sensitive? I'm like, because my body is now aware how bad this stuff is for us, right? And it's like screaming, like you said, really loudly, that get me out of this chemical hell. So thank you so much. And then so your detoxification, like making sure you avoid all the stuff. Love your liver, love your gut. Eat a clean diet with proteins, healthy fats, and then carbs. What did you say about carbs? Can you remind us really quickly again
We
about the
eat
carbs?
too many carbs. We have to really get our carbs into check. We don't get a lot of nutrition from grains. I personally hardly ever eat grains. I
Me
don't see the
neither.
benefit. They're usually inflammatory. They're usually doused with pesticides, which are toxic and cause leaky gut. So I really stick to like clean meat, healthy fats, and vegetables. Like that's my diet most of the
I'm
time.
doing it all, but I am vegan, so I don't yeah, I don't eat the meats, but yeah, exactly. Super clean vegetables, fruits, and then healthy fats and protein, obviously. So thank you so much. All the links are in the show notes. You have that book. What is the best place to find or connect with you?
Oh my goodness. Check me out on drtabatha.com. It's 3 A's, no I's. And listen to the Gutsy Gynecologist show if you really feel like you need more hormone support, because we dive deep into all of this stuff.
Awesome. Thank you so much. We're gonna close the YouTube live right now. So goodbye, YouTube.